Welcome to the American Institute of Healthcare Compliance overview of HIPAA privacy and security video. Today is an overview of basic HIPAA tips to keep your organization in compliance. You and your organization play a vital role in protecting the privacy and security of patient information. Our medical records, whether paper or electronic, contain some of the most private information about us. The government has established privacy and security rules for us to follow. We will use the acronym PHI to reference both protected health information and electronic protected health information during this presentation. The Privacy Rule sets national standards for when protected health information, PHI, may be used and disclosed. The Security Rule specifies safeguards that covered entities and their business associates must implement to protect the confidentiality, integrity, and availability of electronic protected health information, EPHI. The Breach Notification Rule requires covered entities to notify affected individuals, U.S. Department of Health and Human Services, and, in some cases, the media, of a breach of unsecured PHI. It is our job, working in the healthcare industry, to safeguard protected health information, or PHI. HIPAA privacy and security rules address national standards and specified safeguards to promote this. Confidentiality. EPHI is not available or disclosed to unauthorized persons or processes. Integrity. EPHI is not altered or destroyed in an unauthorized manner. And availability. EPHI is accessible and usable on demand by authorized persons. Both covered entities and business associates are required to follow federal and state HIPAA rules. If you are not sure whether your organization meets the definition of a covered entity, check the Code of Federal Regulations, Title 45, Section 160.103. Health plans, clearinghouses, and most healthcare providers are considered a covered entity. Business associates are organizations which are retained by a covered entity to help manage, store, or transmit PHI and EPHI information. The HIPAA rules and penalties for non-compliance apply to both covered entities and their business associates. The Privacy Rule gives our patients the right to examine and obtain copies of their health records. Due to the rise of healthcare identity theft, HIPAA also has a provision where patients can ask for corrections to be made to their medical records. Information should never be removed from the record. However, the correction request should be uploaded into the record, even when the provider refuses to agree with the correction. The Privacy Rule protects PHI held or transmitted by a covered entity or its business associate in any form, whether electronic, paper, or verbal. PHI includes information that relates to all of the following: the individual's past, present, or future physical or mental health condition, the provision of health care to the individual, and past, present, or future payment for the provision of health care to the individual. Covered entities and business associates must develop and implement reasonable and appropriate security measures through policies and procedures to protect the security of EPHI they create, receive, maintain, or transmit. Each entity must analyze the risks of EPHI in its environment and create solutions appropriate for its own situation. This means no cookie-cutter approach to compliance. To review, protect PHI to ensure confidentiality, the integrity of the information, and make sure it is readily available. These responsibilities apply to organizations creating, receiving, maintaining, or transmitting protected health information. Identify and protect this information against anticipated threats such as ransomware and other cyber criminals, as well as people on your workforce that should not have access other than what is required to perform their job. Covered entities must review and modify security measures to continue protecting EPHI in a changing environment. and must consider all of the following: size, complexity, and capabilities, technical hardware and software infrastructure, the costs of security measures, and the likelihood and possible impact of risks to EPHI. Thank you for joining me today for the HIPAA compliance tip. Consider additional professional HIPAA training through our organization. We offer annual staff training, release of information training, and comprehensive privacy and security compliance officer programs. Visit our website for more information.